Good afternoon, everyone. Welcome to the session introducing the 2024 NIH Public Access Policy. My name is Yingting Zhang. I am the Research Services Librarian at the Rutgers Health Sciences Libraries, stationed at the Robert Wood Johnson Library in New Brunswick. In this session, I'm going to provide you with a basic understanding of the new policy and how it is different from the 2008 NIH Public Access Policy and what its key requirements are and how to comply with the policy. The slide presentation is being recorded and the Q&A section will not be recorded. The recording will be made available at the Rutgers University Library's NIH Public Access Policy Research Guide. So if you have a question, please enter it in the chat box and I will address it after the slide presentation. I hope by the end of the session, you will be able to have a better understanding of the new policy, understand what are the major requirements are, and know how to comply with the new policy, and know how to identify the usable resources and the appropriate tools to manage compliance. I want to make sure this is okay. And here is the outline for the session. And I will give an overview of the policy first, followed by pointing out the new changes and the key requirements. And then I will refresh the process of submitting the final peer-reviewed article or manuscript to the NIM system to deposit it in PubMed Central. And then I will also show you how to manage compliance in the NICBI's My Bibliography and how to add a delegate to manage compliance on your behalf. So in the end, we will have a few minutes for questions and answers. So what is the NIH Public Access Policy? NIH has implemented its Public Access Policy, short PAP, since 2008 to make the final peer-reviewed journal manuscripts arising from NIH-funded research accessible to the public. NIH PAP is a term and a condition of award for all grants and contracts awarded on or after April 7, 2008. It's a law and mandatory to comply. NIH-funded researchers must submit their final peer-reviewed journal manuscripts to PMC upon acceptance for publication, making the applicable papers publicly available under the 2008 policy is no later than 12 months. Now, under the new policy, 2024 policy, it's immediately under the official date of publication. Why is the policy important? Because NIH PAP is to ensure that the public has access to the published results of NIH-funded research. The policy aims to accelerate research, generate higher quality scientific results, encourage great scientific integrity, and enable future inquiry, discovery, and the translation for NIH supported research. So on the whole, it is to advance science and to improve human health. The current policy is the 2008 version. It was implemented in 2008, as I mentioned earlier, for all grants and contracts that were awarded on or after April 7th. The original public access policy is still in effect until June 30th this year. Many of you are very familiar with this current policy. It allows a 12-month embargo for the final peer-reviewed manuscript or the final published paper to be made publicly accessible in PMC after the acceptance for publication. In the first few years, when it was implemented, the policy was not that strictly enforced. a compliance rate of 80 or 90% was not uncommon. However, in mid-2013, complying with the policy became much more strict. Failure to comply could result in delay in processing of your award or discontinuation of your award for non-competing awards. In August 2022, the Office of Science and Technology Policy, called the OSTP, released a memorandum on public access for federally funded research. This memo is often known as the Nelson Memo. The memo outlines new requirements that will affect federally funded researchers. The goal of the memo is to provide free, immediate federal, that means without embargo, and equitable access to research that is federally funded. It applies to all federal agencies, including those providing funding in the humanities and the social sciences. It applies to both peer-reviewed publications and the underlying scientific data. So in responding to this memo, NIH updated the public access policy and originally scheduled to implement the new policy on December 31st, 2025. However, on April 30th, the new NIH director announced to move forward the implementation date to July 1st, 2025, which half a month away. Here we are now talking about how to comply with this new updated enhanced NIH PAP. So starting July 1st, 2025, any author accepted manuscript or AAM resulting from the NIH-funded research for publication in a peer-reviewed journal, so journal, not book chapters or other formats, will be subjected to 2024 NIH PAP, which requires the applicable paper to be deposited in PMC upon acceptance for publication and be made publicly accessible in PMC immediately on the official date of publication. So let me reiterate. So you have to start depositing as soon as your paper is accepted. And then by the time when it's officially published, it should be available. So that window can be very short. It really depends on how long from the acceptance and when it's published. And it's your responsibility to comply. So remember, the funding date or the submission date does not impact the applicability of the policy. It is really the acceptance date that impacts the applicability of the policy. That is, the policy only applies to articles accepted on or after July 1st, 2025. Also be aware that there is no cost for compliance. NIH does not require authors to publish in open access journals only just for compliance. So do not pay for OA publishing solely for the purpose of compliance. Remember, it is not an open access mandate. It is a public access policy. So the author accepted the manuscript is the one, if you don't have open access, then you do the manuscript deposit in PMC. So the major requirements under the NIH PAP, here they are. So you understand that as an NIH-funded researcher, your grant, you're granting NIH the rights to accepted manuscript that are equivalent to those of the federal purpose license. So the federal purpose license is something like the right to deposit. It is a royalty-free, non-exclusive license that allows the federal agencies to reproduce, publish, and otherwise use work funded by federal grants for federal purposes. So the federal purpose license is the right to deposit. When preparing your manuscript for submission, And before signing a publication agreement or similar copyright transfer agreement, you must confirm that the publisher's policies allow you to post the paper in PMC in accordance with the NIH Public Access Policy. You can read the journal's open policies at the JISC Open Policy Finder or the journal's website. It is critical to inform the journal that manuscripts accepted for publication on or after the July 1st date are subject to the zero embargo. That is to say, the full text must be made available in PubMed Central immediately upon the official date of publication. So you can hear I'm repeating this like again. That's the major change, but it's critical and it's can be confusing to some people. It is important to include the NIH rights statement in manuscript submitted for peer review. So this can be included in the grants acknowledgement section. The NIH rights statement informs publishers and the journals and that the work is subject to the NIH Public Access Policy, and that NIH as a funding agency has the right to make the author-accepted manuscript publicly available in PubMed Central upon the official date of publication. A sample, I can read you, a sample NIH rights statement can read like this. This manuscript is the result of funding in whole or in part by the National Institute of Health. It is subject to the NIH Public Access Policy. Through acceptance of this federal funding, NIH has been given a right to make this manuscript publicly available in PubMed Central upon the official date of publication as defined by NIH. So this statement can be put in the grants acknowledgement section. So having mentioned all the above requirements, here are some important questions that researchers should keep in mind. The questions like, does your manuscript arise from NIH-funded research? If yes, are you aware that it must be deposited in PMC upon acceptance for publication and made publicly available on the official date of publication? Did you include the NIH rights statement in your manuscript when submitting it to a journal? Does the journal you are submitting the manuscript to happen to be an open access? If yes, does Rutgers University Library have a transformative agreement with the journal or the publisher to cover your APC for the eligible officers? And then if no, does the journal or the publisher permit no embargo deposit, zero embargo deposit? That's important. If there are no transformative agreements between the journal and Rutgers for OA publishing, have you budgeted for APC before submitting to those OA journals? To traditional subscription journals, then what is their policy? Do they allow zero embargo self-deposit in PubMed Central? So for depositing the author-accepted manuscript, who will be submitting for you? If you are the PI and you are not the one who's submitting, remember you have to, who's going to approve? So usually the PI or the PD will approve the submission. And I will mention that later. If you have a research administrator to assist you, have you add that person as your designee in the NCBI to allow them to manage compliance for you? So keep these in mind. This is the screenshot of the NIH Public Access Policy website. As of today, at least I checked, it has not really been updated to reflect the details for compliance with the new policy, other than this statement. So currently, the 2008 policy is still in effect. So all the methods A, B, C, and D, they're still pertaining to the 2008 policy. And visit this website often because I anticipate that new information will be coming very soon. So if the journal you are submitting the paper to an open access, so if the journal you are submitting the paper to, right, is an open access journal, and the journal or the publisher agree to submit the final published paper for you to PMC, then you don't have to do anything. However, if the journal or the publisher will not deposit the paper for you, whether it's an AAM or the final published paper, then you or your designee must submit the manuscript to PMC through the NIM system. The NIM system supports the deposit of an applicable manuscript into the PMC repository. The PI, regardless of who submits, must approve the submission and then approve the formatted version to complete the deposit process. So remember, the approval happens twice during the submission process. Failure to approve will delay the deposit process and cause non-compliance. This is a screenshot of the NIM submission process. So you see step 2 and step 4 involves the approval. If you are the PI, you are submitting, then you will get the email to approve. If your designee submitted for you, then you will receive an email. Don't ignore those emails. If you ignore, then the deposit will not be completed. So here is a screenshot of the NIM system, how you get started. So there is one submitting new manuscript. That's how you start. So you need to log into the NIMS and then start. Many people are already doing it. The only difference is that manuscript has 12 months embargo, but the new policy will not allow that embargo. So when we talk about depositing papers, we are referring to acceptable versions. One is the author accepted manuscript, and the other is final published paper, and they are different. So the final peer-reviewed manuscript, sometimes also called the author accepted manuscript, it's also called postprint. So when we using these terms, we are pretty much referring to the same thing. The authors accepted the manuscript or the peer-reviewed paper for journal publication, it's usually including all the modifications from the peer review process. So that is the postprint. And that version, usually you own the copyright. But some journals will say, you can make it public, you can deposit it in your institutional repository or PubMed Central with an embargo. But with the new policy, the journals, they have to know that your paper is subject to the new policy and has to be made immediately available. So make this very clear before you actually sign any agreement or even submit. And then usually this version is submitted by the author or the author's designee to the PMC through the NIM system. The other version is called the final published paper. That is journal's authoritative copy of the paper. And that includes copy editing, stylistic edits, formatting changes, in addition to the modifications from the peer review process. So that is the publishers or the journal's copyrighted version. If depending whether it's OA or not. If it's open access, then the author owns it because the author pays the APC. And then it's usually submitted by the journal through kind of an agreement. If they agree to, don't think it's by default, they'll do it for you. And you have to go through an arrangement. So PubMed Central ID, the PMC ID is the evidence of compliance. What is the PMC ID? It is a unique identifier assigned to each full text article that are added that has been deposited to PubMed Central. When submitting an application or a proposal or progress reports to NIH, you must include the PMC ID when citing an applicable paper. Here is a sample NIH citation, and it's a real one actually. So you see the PMC ID is at the end of the session, and this style is the NIH citation. So in EndNote, you will choose the NIH style. In PubMed, when you're searching, you want to preview the citation, you choose the NLM style. Other styles may not include the PMC ID. I just mentioned that you must include the PMC ID when citing an applicable reference. Please do not confuse with PMC ID with the PMID. The PMC ID, as I mentioned, is a unique reference number for the full text article that has been added to PubMed Central, while PMID is a unique identifier assigned to each citation and when it's added to PubMed database. So it is distinctly different from the PMC ID, and it is usually only for the PubMed record. So these are different. And here is an example to showing you where they are shown in PubMed reference. So here's a screenshot of Commons linked My Bibliography. So the My Bibliography is a tool that can be used to manage compliance. So when you log into your My Bibliography, if you see something red, that is a flag that you need to take action. If it's associated with an award, then you will choose an option, whether you're starting submitting, whether you already have submitted, or completed. So you do take some action, not just leave it red, because that is a sign of non-compliance. When you see a green one, that means this reference is in compliance. You have taken care of that. When it's green, gray, that means this is not associated with any award. It's not supported by NIH, whether it's in full or in part. So these are the colors tell you the compliance status. Researchers are busy, and if you're lucky, you have a delegate, you have a research admin to help you, then you can add that person into your NCBI, and then you can give them permission to access whether both My Bibliography or just one. My Bibliography, Science CV, these are all tools in my NCBI. The My Bibliography can be used for managing NIH Public Access Policy compliance. The Science CV is a tool for you to develop a NIH BioSketch. That's a separate session. So here you can add, delegate, you can add more, but you can revoke the permissions at any time. So the Authors Alliance has a very good post not long ago, June 6th, I believe, by Dave Hansen, the executive director of Authors Alliance. He had this poster called NIH 2024 NIH Public Access Policy Question and Answers for Authors. I only listed the questions. And these questions can be wrangling in many researchers' minds. So the link, the click is here, the link. I will give all the link later on after the slide presentation. And right now, I cannot even find the chat to drop it, the links. So when you click that, Dave gave very good responses to each of those questions. I just read one of the questions. You were thinking, yeah, that's my question. Researchers are currently signing agreements with publishers for publications that may be released after July 1st. These agreements might still contain year-long embargo, the 12-month embargo provision that conflict with the new NIH policy. Is this a valid concern based on what you are seeing? So read these questions. These are very critical, very important questions. And luckily, he gave suggested kind of responses. The responses are pretty clear. Some of those are very complicated. And NIH hasn't even given very clear answers. So visit the website often. And these are the useful links that I would like to share. So you go to the NIH Public Access website to learn the details, to know, to keep informed of any new information. And that's the overview page. There used to be, this is the NIM system that you submit to your author accepted manuscript. And if you have any questions, this is the FAQ page. And then that's another one through the NIM system. And that's how you access my bibliography. And this is the NIH Help Desk. Believe me, you'll need it because it's very, very helpful. Sometimes some of the questions I feel very hard to answer. And then I usually refer the researcher or the research admin, contact them directly, and they will give you very clear. But they might be so overwhelmed and busy because they are dealing with nationwide questions. And then this is the PACM one, just the authorized people can access to monitor how the compliance status is for a particular institution or school. And then NIH Public Access Help Desk, that's also very important. And then you can see the research guide that I mentioned that this recording will be posted there. And the JISC Open Policy Finder, that's formerly known as the Sherpa service. You will find what their permissions are, what they allowed, do they allow for. So all these are detailed, listed there in detail. The NIH Public Access Policy Q&A section that I mentioned by Dave Hansen from Authors Alliance. So that is concluding my slide presentation, and I'm going to stop recording.